Hi friends, this video is going to be on Montika. Montika has Montelukast Sodium 5 milligrams in every tablet. These are chewable tablets. It's made by Sami Pharmaceuticals. The price for one box is 275 rupees and the box has 14 tablets in it. Montelukast is used to control and prevent symptoms caused by asthma such as wheezing and shortness of breath. It is also used before exercise to prevent breathing problems during exercise, which is bronchospasm. This medication can help decrease the number of times you need to use your quick relief inhaler. Montelukast is also used to relieve symptoms of hay fever and allergic rhinitis such as sneezing, stuffy, runny or itchy nose. Since there are other allergic medications that may be safer, this medication should be used for the condition only when you cannot take other allergy medications or they do not work well. This medication may be used regularly to be effective. It does not work right away and should not be used to relieve sudden asthma attacks or breathing problems. If an asthma attack or sudden shortness of breath occurs, use your quick relief inhaler as prescribed. This drug works by blocking certain natural substances, leukotrienes, that may cause or worsen asthma and allergies. It helps make breathing easier by reducing swelling, inflammation in the airways. Take this medication by mouth with or without food as directed by your doctor. The dosage is based on your age and medical condition, but for adults and adolescents of age 15 years and older, the dosage is 1 tablet to be taken in the evening. If you are using the chewable tablets, chew them thoroughly before swallowing. If your child cannot safely chew and swallow them, consult the doctor or pharmacist for advice. Take this medication at the same time each day. If you are taking this medication for asthma or for both asthma and allergies, take your dose in the evening. If you are taking Montelukast to prevent only allergies, take your dose either in the morning or the evening. If you are taking this medication to prevent breathing problems during exercise, take your dose at least 2 hours before exercise. Do not take more than 1 dose in 24 hours. Do not take a dose before exercise if you are already taking this medication daily for asthma or allergies. Doing so may increase the risks of side effects. Do not increase or decrease your dose or stop using this medication without consulting your doctor. Continue to use this medication regularly to help keep your asthma under control. Even during sudden asthma attacks or periods when you have no asthma symptoms, continue to also take other medications for asthma as directed by your doctor. This medication works over time and is not meant to relieve sudden attacks of asthma. If an asthma attack or other breathing problems occur, use your quick relief inhaler as prescribed. You should always have a quick relief inhaler with you. Consult your doctor or pharmacist for more information. Get help right away if your asthma symptoms worsen and your quick relief inhaler is not helping. Tell your doctor promptly if asthma symptoms, breathing problems, allergy symptoms, number of times to use your rescue inhaler persists or worsens. Remember that this medication has been prescribed before because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people use this medication do not have serious side effects. Tell your doctor right away if you have any serious side effect, including numbness, tingling, shooting pain in the arms or legs, sinus pain, swelling, muscle weakness, uncontrolled muscle movements and spluttering. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling of the face, throat or tongue, severe dizziness or trouble breathing. Before taking Montelukast, tell your doctor or pharmacist if you have any allergies to it or if you have any other allergies. During pregnancy, this medication should be only used when clearly needed. Discuss the risks and benefits with your doctor. I hope you like the video. Please like and share our channel. Subscribe to our channel. Thank you.